Hello, I'm Julianne Good, and this is Psych One-on-One on therapycable.com. Welcome. I am here this evening with Dr. Rick Coons, and we are going to be talking about dialectical behavioral therapy. Dr. Coons is a specialist in this therapy, and Dr. Coons, hi, how are you?
I'm well, thank you. Thank you for having me.
Thank you. And can you tell us a little bit about the work that you do with DBT?
Sure. I'm a licensed clinical psychologist, and I'm the clinical director of the DBT Recovery Center, where we run an intensive outpatient program using DBT. I also have my private practice there, and I'm also a professor at two different graduate institutes.
And which schools are those?
The Chicago School of Professional Psychology and Alliant International University.
And one's in Los Angeles, the other one's in Alhambra.
Alhambra. Mm-hmm.
Yeah, exactly.
Mm-hmm.
Okay. Mm-hmm. Can you tell us a little bit about the work that you do at your clinic?
Sure. So the intensive outpatient program is a mid-level level of care for individuals that are struggling either with addiction or depression, anxiety, eating disorders, and they're all coming to learn new skills, new ways of coping that are more effective than the ones that they're using before they come in. The program is 10 hours a week. There's 3 days, Monday, Tuesday, Thursday. The groups are 3 hours long, and then there's a 1 hour individual. So for those who need a little bit more than once a week, and for those who maybe are coming out of residential or inpatient treatment, this is a good fit for them to help transition them back into their lives and to really submerge themselves into the DBT skills training so that by the time they leave us, they are well adept in the skills and know how to apply them in their lives.
Mm-hmm. Well, that sounds fascinating. It sounds like it's very intensive therapy work.
Yep. Yep.
And for what population again is that?
We tend to see men and women. 20s to 30s tends to be the average age, but we see clients at all ages, 40s and 50s as well, but all adults, all 18 and up. Mm-hmm. And many of them are coming in with addiction issues. But the one thing they all have in common is that they're looking for ways of regulating their emotions, learning better ways of communication, so that they don't have to resort to the addictions or to the other addictions that other people can have, like relationships, work, sex, food. And so these skills are to replace those things so that they can be more effective in their lives and accomplishing their goals.
So are a lot of your clients, have they had prior therapy and then they're coming to you for a better way of doing things?
Sure. So a lot of our most of our clients have had some type of history in therapy. Mm-hmm. Either they've had individual therapy and they're needing something more, or they're just coming out of inpatient and residential and they're needing a step down. That's less intensive than where they were. Many of the clients that we work with are currently in sober living. So as they are in sober living, working on their sobriety, they come to us during the day and we work with them, and then they go back and work with 12 steps, typically, or some other programs. So we're part of a holistic approach for their recovery.
That sounds wonderful.
Mm-hmm. Mm-hmm.
Can you tell the audience a little bit about what DBT is about?
Sure. So dialectical behavioral therapy was created by Marsha Linehan. She developed the approach because she wanted to find a way to work effectively with a population that nobody was having any success with, or very little success with at the time. And so she started working with those who have borderline personality disorder, and that disorder has extreme emotional dysregulation, fears of abandonment, and problems with their interpersonal relationships. And so she started working with them, and she started a skill building approach, and she would create the skills based on what was working, and anything that didn't work she threw out. And what she discovered was that she needed a combination of not only skills that help people change, but skills that also help people achieve acceptance. Because what she was realizing that without acceptance, change wasn't happening. And so you needed both the acceptance and the change in order for real change to be possible. So part of the acceptance skills that she started to create was based in mindfulness. At the time, mindfulness was not a large part of psychotherapy. It's now part of many therapeutic approaches.
Yes.
And one that now, having done DBT for the 3 or 4 years that I've done it, I can't imagine doing therapy without mindfulness anymore, because it helps us develop our ability to observe our mind without reacting to it immediately. Because our mind's going to do a lot of things, and and imagination, trying to control the mind. I mean, it's futile to try to approach it that way. But to develop a way to have some kind of space and objectivity to watch it allows the mind to do whatever it's going to do, and you watch it and you let things go by that are not important to you, and then you attend to the things that you decide to attend to because they are important.
So in other words, kind of non-attachment, non-judgment.
Yes.
Like Buddhist perspective, correct?
Yes, very much so, very much so. So that Eastern philosophy then combined with more traditional forms of behavioral therapy, which were more of the change skills. So skills that help to regulate emotion, to tolerate distress and crisis, and interpersonal effectiveness skills to help with your ability to communicate, ask for what you want, say no, and things like that.
So does it take a lot of the perspectives of, say, cognitive behavioral therapy, because that is a real popular therapy right now, and a lot of therapists do use that?
Yes, very much so. There are a lot of similarities. I saw Judith Beck speak not too long ago at a therapy conference, and I thought she said it very well, that CBT and DBT are pretty much the same. They just focus on different aspects differently. And DBT is more focused on behavioral interventions, action, whereas CBT is more about the thinking and changing ineffective kinds of thinking. But there's a large cognitive component in DBT. We're looking at the ways people are thinking. We're looking at their interpretations, because that has a powerful effect on what they feel. And so a lot of the skills are very much cognitive skills. And in DBT and CBT, some of the concepts or the skills are pretty much the same. They just have different names.
Okay. All right. So that makes sense. So some of the clients that you work with, what would you say would be your toughest client to work with? I would imagine some kind of trauma is embedded within the whole person, correct?
Absolutely, absolutely. The success of the clients all really depend on what they bring. It's all about what the client brings. And when the clients that come in and they're really, no matter what they're coming in with, if their willingness is there, their attitude of openness is there, they just really sink their teeth into the skills and the work, then those are the clients that we just see thriving. And the clients that come in and in DBT, we have the terms willfulness versus willingness. And willfulness being more of a stubborn, I want to do it my way. And coming from a place of fear, or just coming from a place of not quite being ready or open to a different way. And those are the clients that would be the most challenging. And it's really not dependent on the diagnosis per se, or the addiction or what have you. It's more about the readiness and the willingness to approach their lives in a very different way, in a more skillful way.
And as we know, one of the toughest things as therapists that we have to encounter with our clients is resistance. So how much of that do you encounter with any of your clients?
Absolutely. Well, in DBT, we wouldn't even use the term resistance, but we would use the term willfulness, and very similar idea, but that you work with it the best you can. You try to engage them in a way that creates more willingness. And we directly talk about it. We talk about and define what willingness versus willfulness is. We identify what those behaviors look like. We will identify them when we see them. And it's not, anything wrong or punitive. It's just making them aware that there might be something coming up for them that is a therapy interfering behavior, which is a DBT term. And if we've been, I've been a client, if you've been a client of therapy, you're going to do therapy interfering behaviors because things come up and we get uncomfortable and, we want to not go there. When we see that, we work with it, and sometimes we really see clients, especially some clients will really surprise me, in that they'll start off and it's like, oh, I don't know, very willful, and then they'll just be something that clicks and shifts, and then they just start soaring. And then for others, for whatever reason, they're not ready, or they're just kind of stuck, and we keep the door open for them, hopefully in the future, when they're ready, and we work with it the best they can. And hopefully there were some seeds that were planted that might start growing sometime later in life after they've left us.
Mm-hmm. Sometimes that does happen.
Yeah.
It doesn't always necessarily happen in the therapy room.
Yes.
But sometimes it just happens. It's a natural shifting of their perspective. And, sometimes people just need to step away for a little bit. Just kind of let thoughts germinate, let things, change. And so now a typical therapy session, how long does it last? How many weeks?
Our program, it's different than traditional DBT. Our program, we go through, since we're 10 hours a week, we go through all the skills within 4 weeks, which is really quick for DBT. However, the first... usually people stay with us at least like 2 or 3 months, because the first time we go through the skills, it's a good intellectual understanding, because the skills in them of themselves are not difficult to understand. They're pretty basic and simple to get. However, the application of them in life is the tricky part. And so the first month, people understand the skills on an intellectual level. And if they stay with us a second or third month, that's where we start really seeing the application in their lives start to come out. And people getting, that's what that feels like. That's what that looks like. And so on average, 2 to 3 months, some people stay with us 4 or 5, just depending on what their needs are. Some people can only be there for the month. And the one thing that we stress, though, no matter how long they're with us, is that it's all about the practice. It's like riding a bike or playing the piano. These skills need to be practiced. They're not going to be effective at first. Why would they be? They're brand new. They're foreign. It's a different way. So, of course, we have expectations of stumbling with them and not understanding them and them not working the way we want them to work. But the repetition, the consistency, doing them over and over again, eventually they just become part of who we are. And that's when we really see, after much practice, that's when we see the skills becoming really effective.
So what type of homework or assignments do you send home with your clients?
Yes. Well, we work with a workbook. So the structure of it is very educational based, unlike some other traditional forms of therapy. So, for example, the first hour we do a mindfulness exercise, because that's a muscle, a mental muscle that we need to exercise and literally, grow our brain and make those connections. So we practice that every time. Then we go over the homework. And the homework will be worksheets or activities that help reinforce the skills that were being learned. Then we teach the new skill, and then we do like a process where we just kind of open up and talk. There's 4 modules in DBT with 4, and in those modules there's a bunch of skills. So mindfulness, emotional regulation, interpersonal effectiveness, and distress tolerance. And each week we spend a week on each one. Emotional regulation just happens just to be my favorite. And it really opened up my understanding of our relationship with emotions and how effective our relationship can be if we learn how. Because in our culture, we're all in the same boat in that we're set up for failure when it comes to an emotion, our relationship with our emotions. And we're taught to judge them. We call them weak, or that we're going to lose control, or just to stuff them down, or don't feel them, or we're too sensitive, or we're emotional, all these judgments. And so we try to ignore these very powerful and very necessary and very important pieces of information that our brain is giving us. And so instead of pushing them away, accepting them and understanding what the message is, depending on what the emotion is, gives us valuable information. And also understanding that emotions don't have all the information that we need when they arrive. It's a different part of our brain. It's an older part of our brain, a very effective part of our brain. The human species also has the frontal lobe, or in DBT we call reasonable mind. And
which is this part.
Right up here.
That's right.
And that was the last online. It's slow. And emotion mind gets us moving quite quickly. Anyone who's had a strong emotion, which we've all had if we're human, know of how motivating a strong emotion can be. And that's their purpose. They organize our behavior to act quickly. And typically it was needed to be that fast to save our lives. So in the days when we lived in life or death situations and there was a saber-toothed tiger in the woods, that emotion mind was all we needed, really, because we felt it, we felt the fear, we got out of there. And if you had, stopped to think about it, then, you were done. So emotion minds were much more reliable, I would say, in those circumstances. But we don't live in those circumstances anymore, thankfully. Yes. We don't live in life or death situations anymore. However, our emotional brain, our emotion mind, hasn't got that yet. It hasn't caught up yet. And so when it gives us messages, it's still operating with, oh, danger, threat, your life's in danger, act out, lash out. If it's anger motivates our behavior to lash out. And that can be really effective if we're actually in danger and there is a threat to our safety or our life. But typically when someone cuts us off in traffic or says something rude, we still feel that anger and we still feel that urge to lash out at them. However, that's not necessarily the most effective choice since our lives are not actually in danger.
And we could actually endanger our lives by doing that. We've seen that more and more happening with people losing their cool and getting into violent situations because of it.
Yeah.
Most definitely. So.
Yeah. I just saw that recently on the street the other day, just someone getting out of their car and, being very upset at another driver and that kind of anger, as valid as it is, because in DBT, all emotions are valid. We don't judge our emotions. We accept them when they arrive and we ask ourselves, what's the information? And if we follow that action urge of anger in that type of situation, we tend to make things worse, and we do things that make that we later regret. And so we need that ability, and that's where mindfulness comes in, of watching that emotion and being able to say, yeah, of course I feel like lashing out at this person. However, reasonably, I know that if I do, there are consequences. You could go to jail. You could, a lot of things that you don't want. And only reasonable mind has that information because our frontal lobe is where we plan. That's where we set goals. That's where we can think of consequences. Whereas emotion mind can't do that. It's not going to be able to do that. So I hear my emotion mind, but then I pull in my reasonable mind and say, yes, however, what do I want to do here that's going to be in my best interest? And that might be doing something opposite of what the emotion is telling us to do. And that's one of the skills in DBT is opposite to emotion action, where when you are able to pause, feel that emotion, and then decide to respond in a way that's more effective, that might require you to act the very opposite of what the emotion is telling you to do, which is very difficult for anyone to do when emotion is that powerful and it's urging you to do something, and we're trying to force ourselves to behave in a way that's in the exact opposite of that emotion. It's tough, but as our emotions can influence our behavior can influence our emotions. So if we're acting opposite to the emotion of anger, I can then feel a different emotion based on the behavior that I'm doing.
We can channel it into something much more healthy.
Yes. Yeah.
Most definitely.
Mm-hmm.
So, Dr. Rick Coons, thank you so much for talking to us about DBT. And if our audience would like to contact you, how can they do so?
Absolutely. I have a website of drrickcoons.com, RickCoons.com. And you can get my email at rick@drrickcoons.com, rick@rickcoons.com, and email me and I can respond.
Wonderful. Thank you so much.
Oh, thank you for
and
having
thank you
me.
for being with us on Psych One-on-One on therapycable.com. I am Julianne Good, and my special guest was Dr. Rick Coons. Thank you.